Hello, everyone, and welcome to IRSF's RettEd Next Level Nutrition. We're meeting today with Susie Garrett, our world-renowned dietitian from the University of Alabama, Birmingham Rett Center of Excellence, who's going to talk to us today about the nutrition needs across the spectrum that are commonly seen in Rett syndrome and various ways that have proven successful for dealing with getting ideal height and weight and growth in our beautiful children. And then we're going to hear from a few families across the US who have had a variety of different challenges, similar to some of the things that Susie is going to present for us today. And they're going to ask some questions of Susie. And at the conclusion of that parent panel, we will be taking the questions that you all so wonderfully submitted at the time of your registration. So thank you for joining us today. Reminder that being a webcast participant, your webcam and microphone are muted and turned off, so you can sit back and relax and enjoy the presentation today. I'm Paige Nuez, Director of Family Empowerment for the International Rett Syndrome Foundation. And on behalf of our Board of Directors and team, we want to thank all of you for all of the support and wonderful awareness that you raised in October Awareness Month. And we wanted to thank everyone who joined us for our live virtual gala last weekend. And we hope that you certainly enjoyed that opportunity to hear stories and messages from our science team and about all of the wonderful progress happening in the world of Rett syndrome. For our education programming, we want to thank our sponsors who allow us to invest the majority of your hard-earned donations towards research by these folks supporting our education programs. So we do thank Acadia, Novartis, and Taysha Gene Therapies for their ongoing support for our empowerment programs. They know it's important for you all to be able to live with Rett syndrome in your day-to-day life while they work to advance research towards treatments and a cure. I also want to remind everyone that we are fast and furiously planning for our in-person summit in Nashville, Tennessee, April 27th through 30th. We hope that you're able to join us for the Ascend National Summit, and registration is open. So please visit rettsyndrome.org to look for further details. Okay, we have a lot of information to cover today. We have a lot of great stories to share, and we have a lot of information to bring to you. So I'd like to bring on Susie Geerts. And she's going to bring up her slides now. And Susie, welcome from Alabama. Thank you for joining us at the end of a busy clinic day.
I appreciate it. I welcome everybody. And I really like this format because, as I told Paige, I do have a lot of information to share, but as we all know, I think it's very important that the Rett family share together, and each of you has your own story. But it also helps me to learn, and it helps our audience to learn as well.
Okay, so Susie, while you bring up your slides, I just want to remind everyone that if you have any questions for any of our presenters, whether it's Susie or the other parents, you can go ahead and type them into the question field at any time, and we'll take those at the end of our presentation. Great. Okay, Susie, take us.
Oops. Okay, first of all, as usual, a little bit of financial disclosures. I am part of the Rett team at UAB Rett Syndrome Clinic here in Birmingham, Alabama. My employment at UAB is funded by several different grants with the MCH division. One is through neurodevelopmental disabilities. The other one is through nutrition education, leadership, and pediatric nutrition. And then also our center where I work is funded by the University Center for Excellence in Developmental Disabilities. And I also do consultant for Arcadia Pharmaceuticals. Learning objectives today are very brief, because I really want to have time for discussion, because that's our focus for today. We're going to talk a little bit about some of the things that COVID taught us in Rett syndrome care. We're going to again look at good nutrition basics, because the foundation of our health and growth is good nutrition basics. We're also going to look at Rett nutrition therapy. We're going to look at GI nutrition risk factors that are common in Rett syndrome. And then we're going to be discussing these in detail. So this is really a good format to get started with. We're going to talk about new information about formula compositions and trends. There are a lot of trends in nutrition, and right now I think that there are some really good ones. So I'm very encouraged by a lot of the things that I'm hearing, like blenderized feeding. So it's exciting to talk about that. And last but not least, we're going to talk some about food allergies, food intolerances, and a little bit about the microbiome and the metabolome as well, because there's a brand new article that came out in May, which I found very informative. And I know probably most of you have seen it already, but I kind of wanted to give us a background about why we are looking forward to this area of science. Okay, a little bit about what we learned through COVID. We were very fortunate here in Birmingham. Our active clinic was not shut down very long. So then we were able to start back again, of course, with COVID safety measures. So we actually were able to continue seeing families for the most part. We were also seeing families via telemedicine too. So we've actually continued with patient care even through the COVID shutdowns. Some things that we learned though is some of the girls did contract COVID. And as you know, part of the presenting symptoms of COVID is sometimes changes in loss of taste and smell. And so some of the parents afterwards would tell me she just didn't seem to get her appetite back. And I wondered if it was that continued loss of taste and smell. But I know in thinking about one case, the young lady, it was a young adult, she continued without a good appetite for almost 15 months after she made her COVID recovery. And then we were also seeing continued weight loss. So again, I just kind of wonder how much those two things play. And of course, the girls can't tell us if they have a loss of taste or smell. So I thought that was one thing that I had to be more mindful of. Of course, many people were in COVID isolation. Many of the girls and the young adults could not go to their regular daycare programs and school programs. We did see some people who gained weight, but that was also common across the board, even with children with developmental disabilities. I saw children that both gained weight and also lost weight during their period of isolation. So that was pretty variable. There were shortages in formulas. There still remain shortages in formulas across the board. That has to do with shipping delays. So sometimes we had to change formulas, although we didn't really want to. And then also a lot of vitamin and mineral products. The parents were telling me, I can't get that anymore. I have tried. I've looked several different times and I can't even find what I need anymore. So we are hearing less of that at this point in time. But again, I do know that there are shortages. And a lot of times the things that we found in the stores before were not in the stores at all, and they're still not. I think people begin to feel like maybe we need more vitamins and minerals. So that sort of slanted that market altogether. There were many caregiver challenges. A lot of the girls were no longer in the caregivers, and they had new caregivers coming on board. So a lot of challenges regarding that. And then of course, there were delays in seeing GI specialists. Here in Birmingham, you can go back to seeing GI specialists now, but now they have huge wait lists. So it just continues to delay care. And sometimes there were even delays in vital therapies. Again, the foundation of good nutrition is very important because it's so important for health and growth in everybody. And nutrition is an extensive, complex science with a long history of research, utilization, and change. There's also a lot of controversy in nutrition. And so we learn from each other and we grow from each other, even through the controversies. Good nutrition and healthy eating are principles that are the same for everybody in the family. We want the parents and all of the family to be well. But sometimes with our Rett clients, we do have some special nutrition needs. Why do we need to eat well? For growth, energy, maintaining healthy skin, integrity and immunity, the fighting stress of illness, injuries, and surgeries, protective factors such as the antioxidants, where we can actually strengthen our cellular level and perhaps prevent things such as cancers and those type of things. So protective factors are also very important. And pleasure and social aspects. I think that this is so important. If we have families that are really struggling and every mealtime is a struggle, then that is a sign that we need to come up with a different plan. And eating should be very social. It should be pleasurable. Usually the girls really enjoy eating, and it needs to be a pleasurable experience for the whole family. What are the necessary nutrients? And again, this is a science of nutrition. Carbohydrates for energy sources, vitamins and minerals, and fiber. Protein is very important. It builds and repairs tissue in the body and fights infections. Fats are very concentrated sources of calories, and we often think of limiting fats in our diet, but actually they are carriers of essential nutrients. Vitamins are vital elements that promote normal chemical reactions in the body and protect against infections. Minerals are essential elements that promote body structure and repair and carry out chemical reactions. And water is very important. The human body is about 88% of water, and this is essential to carry out body functions and transport nutrients. And so really those are the 6 basic ones, and I always add fiber because it's very important for everybody for fiber because it does nourish our microbiome. And with our girls, it's especially important because constipation is so prevalent in our patient population. So in order to give us a foundation and some type of pattern to go by, we often look at choosemyplate.gov. And as you know, it's a very simplified pattern, but it actually is well thought out, and that it includes all the different food groups, fruits, vegetables, grains, and protein. It includes protein and dairy because those are our major sources of proteins, although there are substitutes and alternative proteins in the diet as well. But one thing that I wanted to point out is actually you hear a lot about the plant-based diets now. But in looking at this plate, if we look at the vegetables and fruits and whole grains, even the MyPlate concept includes really a plant-based diet. Our diet has always been plant-based. And then we add in a little bit of the animal sources or plant-based sources of protein, again, to keep us healthy. And what's really important is to remember variety. You should always have a variety of foods, and that's what the MyPlate concept tried to inform us about, is that there are many fruits and vegetables, and there are many types of grain products that we can incorporate because it's through a variety of nutritious food just how we actually get to achieve all of the nutrients that we need. Choosing a multivitamin, you really have to assess if your child needs a vitamin or not. If they are on a healthy diet and have a good vitamin D level, they may not even need a multivitamin. And also if they are consuming supplements, such as some of our standard formulas that are out there, they may not need a vitamin. So this you can assess yourself, or you may want to talk with your pediatrician, or if you're working with a dietitian, talk with your dietitian and say, do I really even need one? Remember that most of the vitamins, if you're going to choose a vitamin that they need to provide close to about 100% of your vitamin needs, most of the time they have little or no calcium. So if you're one of those families that need to add calcium to the diet, then you may have to add a separate calcium supplement altogether. Read the dosing label carefully and make sure that you're going by the age recommendations. Typically, we can use pediatric products till about the age of 10 to 12, and then after that, we can move to adult products if it depends on what their size is too. So if they remain really small, sometimes you have to ask yourself, do I need to stay on a children's multivitamin or do I need to move to an adult multivitamin? So again, your pediatrician or nutritionist can help you decide what's the best thing to use. There's many different forms that are available, chewables, gummies, and liquids. But of course, you have to choose the appropriate one. If we have a child that has a weak chew, it may be hard to get down a gummy. Liquids have been very hard to find. In general, liquids for children are hard to find, and also liquids have been very hard to find in general, especially with the COVID changes. So we're just now getting back to finding more of those. Remember, there are some vitamins that are considered to be fat-soluble vitamins. They are stored in the body, and if you get in excesses, you can actually get toxicities. So always be careful with A, D, E, and K. We try to choose cost-effective supplements if we need them. Make sure that they're stored away because they're not candy. And then also there are so many different products now. It amazes me. And they change sometimes. You may have them 2 years, and then for 2 years, they've changed the whole composition. They've changed the label. There are many that you can order online. So again, usually if a person has a vitamin and mineral question, I usually have them bring the product in so that we can discuss it. And again, if you choose to use alternative forms of therapy and supplements, make sure that you do so with the supervision of your medical professional, especially your pediatricians, neurologists, and other specialists. Another thing that we really focus on is bone health in Rett syndrome. The girls do have weakened bone health, and the exact mechanism is not known. There are many things that we don't understand in nutrition. There are a lot of things in Rett syndrome that we're not clear about, and this is one of them. So what we do is we try to make sure that they're getting calcium, the adequate amount of calcium at all ages. Vitamin D, we like to prescribe that you keep their vitamin D level mid-range. Whatever your lab normal is, we like to see that you try to keep the level mid-range, and that's to help to protect bone health. Now, it's good to get a baseline vitamin D level so that you know what it is. Sometimes your neurologist is already following this if you have a neurologist, but after that, it's usually good to try to check a vitamin D level at least every year or every 2 years, just to make sure that it's staying in that mid-range. And also, it's surprising we don't have a good understanding about vitamin D metabolism either. Sometimes we'll think, oh, well, she's going to be deficient, even though we're working very hard to provide the level that we need. And sometimes we find that they're at the upper level of where they need to be, even though it doesn't quite make sense. So again, it's the whole vitamin D metabolism thing is not clearly understood. So what we do is just monitor it carefully. Weight-bearing exercises as much as possible help to build bone strength. And if your child is on medications that interfere with bone health, then we need to make sure that that's taken into account, especially some of the older seizure medications were really bad on bone health. And some of the birth control and menstrual management methods are also bad on bone health. So we have to choose carefully to make sure that we are meeting their needs. And a little bit about alternative milk trends. Really about 8 years ago, we started seeing a lot of alternative milk trends. And now we have the oat milks, and we have pea milks and all of these other things. And sometimes they're not created equal, but now we have a good variety of things that we can choose from. But again, make sure that you clearly understand what your goal is and what milk product, if you use milk at all, which one is the best for your child. Nutrition goals in Rett care. We want them growing and healthy, and we monitor them closely. We want a good weight for height at all ages. You often hear the BMI term used. The BMI is sometimes not very reliable if the girls are short of stature, and many of them are, as we know. So we really look for a good weight for their height. And that really is sometimes a much more reliable measure than even that old BMI level is. We need reserves for illness. It was always interesting to me that when a typical child gets sick, they may lose a pound or 2. But sometimes when the Rett girls get sick, they may lose 5 pounds or even more sometimes. So we're not really for sure what that mechanism is. But sometimes we allow them to be a little bit over their good weight for height, just so that if they encounter illness, then they have some reserves for illness. We always need to try to make sure that there are feeding difficulties or GI concerns, that we get the appropriate evaluation and treatment for those. Again, promoting good bone health always is very important. Finding cost-effective therapies as needed. If your child has to have surgery, then we want to make sure that they are prepared nutritionally for that surgery. And then in recovery, we want to make sure that the nutrients are there in the proper amount so that they can have as fast a recovery as possible. And recognizing change, I find Rett families to be very good at recognizing changes and identifying the appropriate healthcare professional to talk to about that. And also just understanding that change happens. I've had parents tell me, well, my child had a swallow study 8 years ago and it was fine. Well, things can happen in between times, and sometimes the GI tract can change. And so, like I said, I often find that Rett parents are wonderful at recognizing change and then also seeking the help that they need. Some of the things that we know that are GI risk factors in Rett syndrome: our girls encounter many GI problems, such as poor chewing, reflux, air swallowing and bloating, hyperventilation, constipation, gallbladder disease, and others are very common. And so often a GI physician and a GI medical team is often part of their care. Sometimes we experience poor growth despite good appetites. And sometimes we're not for sure about what these mechanisms are, but we try to identify the source and address those as soon as possible. There are food allergies and intolerances across the board. Picky eaters and food aversions, we see those in all children. Kids will get stuck on a certain thing that they really like, and we want to give it to them because that's what they really like. But sometimes we have to make sure that we move past those picky eating patterns to try to assure the variety that we need to keep things healthy. Recent weight loss or gain is always something that we try to get to the bottom of. Of course, with loss of their purposeful hand use, sometimes they cannot self-feed, and we have to make sure that they have assistance at home and at school and in many of the programs that they attend. Low bone mineral density is common. Dental health is very important. It's very hard sometimes to find a special needs dentist, but they are out there and they do know how to help and to take care of patients with special needs. Malnutrition is a term that used to come up a good bit, and it still does if you work in a pediatric feeding environment. But malnutrition in the pediatric feeding environment means that they are not meeting their nutrition needs. And so we have certain criteria that we watch for to make sure that if we're seeing these problems, that we can identify these lack of nutrient intake and then address them appropriately, but also code them appropriately. Sometimes malnutrition terminology comes up with coding because you want to make sure that it gets coded appropriately in the medical record. Drug nutrient interactions, there are lots of, there's books written about these, but again, some of the common meds that are in use can also interact with some of the nutrients that are in the diet. There are social issues and lack of financial resources sometimes to meet the needs of our clients. And so we have to work hard to see if we can overcome those and find additional resources to help. Some of our girls are on very specialized feeding therapies, and that's because they may have complicated GI problems. And so they may even include sometimes feeding by IV, but we try very hard to try to get to the root of the problem and identify some type of feeding method that we can use so that their GI symptoms are less and they can return to their normal activities and be happy again. Normal puberty. Puberty is interesting in Rett syndrome in that typically, even though the girls may be short of stature, it has always been interesting to me that they sort of start their periods at a sort of age-appropriate time. They may be short of stature and they may also not weigh very much, but they still sort of start their periods at an age-appropriate time, which typically, and we have data to tell us, in the Rett syndrome population is still about average, about 11 or 12 or so. So it's not early, but you would think with these very small girls that they wouldn't have periods like they do, but they do. And usually it's a pretty age-appropriate time. But what's very interesting about growth is that once the girls start their periods, we have data that tells us that they're almost fully grown. Typical girls will grow for almost 2 years after they start their periods, but with our Rett girls, as soon as they start their periods, they are almost fully grown. So we have to sort of shift our emphasis away from sort of maybe high protein, high calorie to a more healthy diet so that they don't gain weight at that time, because we don't want them gaining weight, because it can be very difficult to sometimes reduce after they've gained weight. And of course, scoliosis is one of the things that we see. We want to have them prepared for surgery, and we want to have them recover quickly afterwards. And good nutrition can help with that. Food allergies and intolerances. Many of the girls have food allergies. That's probably one of the first questions that I ask. Because as you know, food allergies are actually an IgE mediated response. They can have severe reactions sometimes, which can include hives, skin rashes, vomiting, but also sometimes you can have tightness in the throat, which also makes it hard to breathe. And sometimes it can even be a life-threatening situation. So one of the first things that I always ask is, do we have any food allergies? And of course, there are common food allergies, such as eggs, milk, peanuts, tree nuts are some of our big ones, and shellfish. But then there are also minor allergies too, such as wheat and corn. So it's always helpful to go to a good allergy clinic where they do comprehensive testing. And I was glad a while ago we had an earlier conversation, and sometimes food allergies go away. So you need to make sure that you go back and sometimes review and just see, has this gone away, or is this something that we still need to be mindful of? And there are also food intolerances, and food intolerances are different, and that a food intolerance is actually where you don't tolerate a component in the food itself. And the most common one that we think about is lactose intolerance, where you can't digest the lactose, which is in milk. So food intolerances are different than food allergies, and that they're not an immune response. They're more of a physical intolerance, or that you can't break down something in the diet. Now, we also briefly were talking about food sensitivities. Food sensitivities are very interesting. There's not even really a medical diagnosis called food sensitivities, but we do know they exist. We see them in our girls. They are suspected to be an IgG type of immune response. So it's different than an allergic reaction. Typically, they are milder. There are some blood tests that you can do, and there's a proliferation of things out there on the internet about doing a blood test so we can see what food sensitivities that you have. But some of those companies are not very reputable, and some of the testing is also questionable whether it's reliable or not. So the best thing to do is to try to work with, if you have a GI or your pediatrician, go to them with a really thorough history and say, I think she's sensitive to this. And sometimes what you can do is take those offending agents out of the diet for 2 to 4 weeks and then put them back in and see if you're still seeing the same type of reaction. So that is called elimination diets, where you eliminate things and then you add them slowly back in. But again, the area of food sensitivities is something that we need much more information and research about so that we understand that better. I do think they exist, but again, work closely with a GI team or your pediatrician so that you can learn how to handle those in an effective way. Okay, there are many different things that we do in Rett syndrome to help improve their nutritional status. But the one thing that I want everybody to remember, in addition to variety in foods, is also individualized care. Each of the girls present with a different picture. And that's one of the things that my many years in working with Rett syndrome has taught me, is that each of them are individualized. And so we have to make sure that we're looking at them as an individual and making sure that their nutrition care plans are also individualized. Sometimes we modify the texture, we modify the calories to help the girls grow better. Again, we make sure that they get an adequate calcium for age, monitor the vitamin D level carefully on a regular basis to make sure that it's staying in that mid-range area. If you have to have nutrition formulas, there are many out there now, many more so than we used to have before. I'm a big believer in blended feedings and blended formulas too, because there are many things that you can do at home to help improve the situation. Make sure that there's proper positioning. This seems to be easier when they're smaller because they often have supportive seats and stuff. It's not so easy when they get older. Sometimes they still need proper seating things as they get older to make sure that they're in an upright position and able to swallow the way that they should. But as I said, it can be a little bit more difficult as adults. And sometimes you have to be really pushy to get the equipment that you need to make sure that they are supported appropriately. Good hydration is essential. Control of GI symptoms as much as possible. Individualized feeding programs as indicated. We're going to talk just a few minutes about G-tube placement. Catch-up growth if indicated. If they've lost weight, we need to make sure that we sort of up the game to make sure that we're putting that weight back on again and on track the way that they should be. We need to prepare for surgeries if we know that they're in our future. Meeting the nutritional demands of puberty. And again, you have to be careful that we're very careful about the onset of obesity when they go into adulthood, because we like to try to prevent that. A little bit about one of the questions I get asked a lot about is G-tube placement, and it's something that's very hard to talk about. So what we did at UAB is we actually came up with a checklist. So that if we have concerns that perhaps our client needs to have a G-tube, we can actually go through this with the family so that they have a better understanding of why we feel like that they may be looking at having a G-tube placement in the near future. And this is our checklist. Is medically necessary for aspiration, severe dysphagia, dehydration on a regular basis, poor growth or excess weight loss. Medication administration, many times the girls will not take the medications that they really need. So sometimes it's helpful to have that G-tube in place so that their medications are taken on a regular basis so they can be effective. Need for weight gain for surgery. If there is any evidence, again, of malnutrition, again, the term malnutrition means not getting in the nutrients that they need. And other GI indications such as fistulas and stuff. So again, we purposefully came up with the checklist so that everybody had a better understanding. We were all on the same page when we had to have this discussion. And I'd highly encourage you to talk with your team too about, what do you think is an indication for this if you feel like it's something that's in the future. Tell them, please, I want to have a clear understanding of why you feel like she needs a G-tube placement so that I can make a good decision and take an active part in this decision making. And I always like to review common choking hazards. If our girls are having chewing and swallowing problems, then we need to make sure that we're watching out for these foodstuffs, dry meats, popcorn, hot dogs, grapes, peanut butters that can get stuck in their throat, nuts, raw vegetables, any fish with bones, hard candy, or candy with nuts that they can't get down. And also make sure that their utensils are sturdy so that they don't break off, or if they're having a bad day and they happen to bite down hard, that the utensils don't break off. But mostly I like to remind everybody, please take CPR classes and take CPR classes on a regular basis. It's easy to do now, and a lot of them are online. And I was interesting now, they even have training courses in the airports when you fly now. I recently was flying someplace and they actually had a kiosk where you could take a CPR class and also practice your CPR while you waited for your next flight. So again, it's pretty easy to do, and all caregivers need to make sure that they have a CPR class because it may save your child's life, but it may also save someone else's life in your family too. So I always say that. Okay, lots of supplements now. And I think it's very fascinating how fast this market has proliferated. We sometimes can use foods to achieve our high protein, high calorie intakes. Sometimes we have to add feedings. There are our whole foods blenderized feedings now. I'm totally in support of this. I think that many parents and many of you have perfected what we need to know and what we need to do to make sure that the blenderized feedings are safe. And I do think it's good to share recipes sometimes, but do remember that some of the girls have really specialized feeding needs and that sometimes the recipes may not be appropriate for everybody. We're hearing a lot now about plant-based diets and plant-based formulas. And I have parents come to ask me about this now. I want my daughter placed on a plant-based formula. And there are some good ones out there now too. So we have a lot that we can choose from. But one of the terms that I wanted to share with you is now some of the formulas are actually getting a rating, and it's called the PDCAAS rating. And this actually is an old term. It came out in the like in 1989, early 90s. And what this means is it's actually a term that means protein digestibility corrected amino acid score. So it's the PDCAAS. And what this means is that the formulas are rated. If we look at just natural foods, eggs and milk are very high quality protein. They have a lot of the essential amino acids that we need for growth. And they have a PDCAAS rating of 1. So if you were looking at a formula and it's rated and it gives you the PDCAAS rating, you want it to be close to 1, because that means that it has high quality protein in good ratios to help to promote health. I'm seeing these ratings come out now. A lot of it's from an international sense. And so if the company's an international company, then you may see that when you read about their products that it gives the PDCAAS rating. So I wanted you to know what that was, because that's pretty new. We used to not use that terminology much, and we didn't see it when we were evaluating one formula from another. So that's a fairly new thing. A lot of commercial products out there now, and you hear a lot about organic blended formulas. A lot of people are asking me for organic or plant-based. You also hear a lot about clean diets and incorporating clean diet foods into our blended formulas. So a lot of new things have happened over the last 15 years or so. There are also thickener now. So if your child is one that requires thickeners, there are also thickeners now that are organic based that we didn't have before. So it's nice that we have these new tools available to us. There are lots of stuff in the grocery store that you can buy sometimes without buying commercial formulas. If your child is just on a pretty typical diet and doesn't have a lot of intolerances or allergies, remember variety. I think if somebody told me that I had to drink a chocolate shake every day, and I like chocolate shakes, but I think that I would get tired of it. So it's really good to have a variety of different supplements. And again, as well as introducing a variety of foods into our blended foods. Okay, there may be a lot of people that need to be involved in your life. We often make referrals to GI medicine here. We often make referrals to our children's hospital allergy team so that we can clearly define if there are problems, what we need to do to treat and help the girls feel better. Sometimes they do need a feeding evaluation and therapy. It's especially important when they're younger so that we can kind of figure out where the source of the problems are. And always remember that feeding therapy is very much play-based. So if we start it at an early age, hopefully we can have some positive outcomes by starting it early, because it's very play-based in the very beginning. If you need a dietitian, sometimes if you live near a children's hospital, it's easy to find one. your pediatrician or your primary care physician might be able to help you locate a dietitian to help you through this journey. And they may tell you, I have not worked with Rett syndrome before, but if that's the case, please tell them that they're welcome to contact me here at UAB, and I'll be glad to try to share with them what I know about caring for our families and our girls and young adults with Rett syndrome. And there's actually a slide at the end of this that gives you some information how you can contact my professional association, the Academy of Nutrition and Dietetics, and they can also help you locate somebody in your area to help work with if you need some additional assistance. A lot of other healthcare professionals are involved in your child's life: occupational, speech and language, rehabilitative medicine for our young adults. So there are many other people that are involved in this nutrition care and wellness journey together. Home health and pharmacy care support. I do a lot of work with DMEs these days because we have to identify people that can help supply the things that we need at home, whether it be tube feeding supplies or special formulas at home. And sometimes the best place to check is your local pharmacy. If you work with a pharmacy and you let them know that you have a client with special needs, often they will give you discounted prices so that you'll be able to meet their needs easier. And all you have to do is just ask. They may say no, but I have found them to be very helpful, and sometimes it's been very surprising, some of the things that they come up with. Okay, again, sometimes our girls do need feeding evaluation. They may need feeding therapy. If we do an evaluation, we'll find out if it's functional, sensory, or behavioral. I believe in feeding therapy. The earlier the better, but it's never too late. A little bit about Rett syndrome. In our clinics, we use both typical growth charts and we also use the Rett syndrome growth charts. And if you go to rettsyndrome.org, you can find the Rett syndrome growth charts there. They help us to track our growth journey along with other people that have the same genetic diagnosis. So I feel like the Rett growth charts are very helpful. And we keep both in your child's medical records, because the typical growth charts just help you track progress, but then the Rett syndrome growth charts also help you put it in perspective. So typical growth charts, these are our Rett growth charts. And I do feel like sometimes there are critical phases in nutrition that we have to sort of get through, and I sort of break it down into 3 different categories. In the beginning, we need to figure out where we are with feeding. Sometimes we need to make sure that our textures are modified the way that they need when we add supplements if we need to. But it's kind of funny in those early school years, because the kids can cycle where they may get taller and then they gain weight. But we do recognize that as we closely monitor their growth. They do seem to change. They kind of go from that baby look where we have the nice little baby arms and the little baby legs, and they increase in muscle mass overall. And we do see that. But sometimes it's in this phase when they start to hyperventilate, and sometimes it can be very hard to feed them around the hyperventilation and also the air swallowing and the bloating. So most of the families have learned to work through this. You can get help from a feeding therapist if necessary, but most of the families learn to work through this, and they share it with other caregivers so that we make sure that we can maintain good feeding practices at that time. And seizures sometimes can really occur at this age, if they occur at all. Some of the girls never have seizures, but we often see that they start at this age. And sometimes the girls can be sleepy, and some of the seizure medications can change their appetite. So we need to make sure that we're monitoring carefully and asking for help when we need it during this time. The second critical phase is adolescent. We really want to push them in those early years, because since they don't grow as long as typical kids, we want to make sure that we are meeting their needs and making sure that they can grow as much as they possibly can, and always keeping in mind that they usually stop growing much earlier than the typical patient does and the typical child does. And also during those adolescent years, the scoliosis may start to progress rapidly. Our physicians are always checking for scoliosis. They are making referrals for orthopedic evaluations on a regular basis to make sure that we are keeping up with those changes. And the third critical phase is adulthood. Adulthood for the girls starts early. Dr. Percy says that there seems to be a trend for them to stiffen and slow as they get older. And often associated with this is their calorie needs really get significantly lower than they were in that early phase of growth. There are lots of social changes. Many times our girls are finishing schools and then they are moving on to adult daycare programs, or some of them may also be at home with caregivers at home. So these social changes sometimes can be bring changes in their nutrition status. And many times what we see is that we have to really shift to healthy eating patterns and use supplements as needing, and special formulas as needed. It's very interesting. I work with a number of young adults that are tube fed because of aspiration risk. And many of them in their adult years only require 800 calories, 900 calories to maintain that good weight for their height. When you get down to that calorie level, you really need to make sure that you specialize and that you modify it to each individual, because it's very hard to meet all of their nutrient needs, all the things that we talked about in the very beginning. So they pretty much have to be custom made and modified to make sure that we are maintaining appropriate health, keeping their weight the way that it needs to be, but also supplying all of those nutrients that we need. So at this point, you may also need to seek out some specialized help to help achieve that. And again, we need to make sure that we're monitoring their health status. It's always so interesting to me that it's very hard to get a weight on some of our family members. And I've even had to push in my clinic, in one of the clinics that I work in, I've had to push to get a wheelchair scale. We have to have one, and they are expensive, but it's absolutely necessary that we have a way to weigh them and to weigh them accurately so that we know as an overall indicator what's happening with their health status. So very important. And so that's something that you really have to work toward, because it can be a challenge just to find a way to weigh them appropriately. Again, obesity can happen in adulthood. It can be hard to reduce. So we want to make sure that we sort of are proactive and make sure that we're watching it. I had a student that studied with me back in 2015. We actually took some of the natural history data and we looked at girls over the age of 20 years of age, 245 people we were able to pull data on. And the results were that as adults in that patient population, that about 48.2% had normal weight for height, about 11% were overweight, and about 40.8% were obese. So if you put the overweight and obese together, that's about 51% of the population got heavier as they got older. And now that we recognize that, we can be proactive and to help maintain their weights earlier and make sure that we have the appropriate feedings for our adults as much as possible, because again, it can be very hard to reduce. One of the things that you have to do is, as they get older, and also always just find positive ways to show them and to keep them occupied. We used to have a problem with schools, and that often they would reward them in the school programs with candies and things like that. We're seeing less of those issues now, but there are lots of things that you can do to show pleasure and to keep them happy without integrating food and candy and things like that. But it's nice to have a bag full of those things that helps your child to be happy, including massage and playing in water, combing their hair, holding their hands. All of those things can be used to help to increase their happiness without including a lot of extra foods. And the last thing that I want to talk about is there's really a great article that came out in May the 6th, 2021 in Plus One, and it was about the Rett syndrome and microbiome. It's called The Assessment of the Gut Bacterial Microbiome and Metabolome of Girls and Women with Rett Syndrome. RettSyndrome.org helped to finance this study. It was done by many of our friends at the Baylor College of Medicine, including Dr. Dan Glaze and Dr. Kay Motil, GI medicine doctor, who have been longtime friends and longtime researchers in the Rett syndrome world. And this article, I think, was very important in that it sort of shows us the future of where we're going. So I thought what we'd do is we would first define what microbiome is. And the microbiome is actually a community of microbes that live in a certain ecological environment, such as the bacteria, fungi, and viruses that live in the GI microbiome. So again, it's sort of an environment. Now, the metabolome is different. We think of ingestion of foods, we think of digestion, absorption, and metabolism. So the metabolome is actually looking at the metabolism area of our food intake. And this is a very new area of study, and we've not considered this until recently. So I think it's so futuristic that they have chosen to look at this. And the definition of metabolome is a complete set of chemical compounds involved in an organism's metabolism. It includes the metabolites that are produced by the cell during metabolism, and they provide a direct functional readout of cellular activity and also psychological and physiological status of the organism. So very, very advanced concepts. And I really like the article, and I would encourage all of you, if you have time, to look at it, because it really focuses in on our Rett population. And some of you probably participated in this study. They took 44 girls and women with Rett syndrome, 21 age-matched unaffected females, and they looked at Rett syndrome severity, GI symptoms, feeding difficulties, composition of formulas that they were consuming. And then they looked at their microbiome, the bacteria in the GI tract, but then they also carried it that futuristic step where they actually looked at the metabolome as well. So, and they are hoping someday to perfect this type of studies and try to use the information that they find to help with new drug therapies for the GI tract, but other health concepts as well. So like I said, it's a very futuristic look at where we're going. And I think it's so wonderful that we have moved here. Very complex, very new, but we're all going to learn together. And I do think that it's going to yield a lot of good information as time goes by. Summary and questions. Again, adequate nutrition is necessary for good health for the Rett clients, but also for caregivers as well. Proper growth is maximized by good nutrition during childhood. Calorie needs are generally lessened in adult with Rett syndrome, and so we have to be cognizant of that and be proactive with that. Parents sometimes have to seek assistance if there are special GI problems and also special feeding needs, and those resources are out there. You can ask your pediatrician, ask your primary care medicine physician, and then also you can contact the academy if necessary to find somebody, and they can always call here, and I will try to help them work through some of the things that they're seeing if they've never seen a Rett syndrome client before. And these are resources, and y'all can all reach me if you ever need to. My email is below. And that is it. And I'm looking forward to the rest of our conversation.
Susie, thank you so much. That was an incredible presentation. The information is so thick and so deep. I'll take this moment to remind everyone that this presentation is being recorded, and we will post it on our YouTube channel shortly after today so that you can go back and reference it. And in addition to using the resources that Susie shared, you can share this recording link with those on your care team. Gosh, every time we meet, Susie, you add a few more slides, a few more nuggets of information, and your presentations just get better and better. And I know that's a direct result of families challenging you and
Yes,
asking
ma'am.
questions.
Yes, ma'am, you bet. I have to learn, because like I said, they come to me and they say, I want to try this, or I need this formula, or I want you to change my daughter. I want it changed to this. It's because they are better informed. And I think it's wonderful that they feel like they can challenge, and let's change things. Let's make things better. We have made things better with the stuff that we know, but we can continue to do better. And I know many of the families and a lot of the parents have shared their information with me, and I learn from parents. And again, just the challenges and the future is tremendous.
I agree wholeheartedly. And thank you for being so open-minded. And I hope that all of the professionals working in your child's life, for our families who are listening today, are working with professionals who are open to your aims and your goals so that you have the best quality of life. As Susie said, statistically, we know nutrition is almost a universal issue with our children with Rett syndrome, but they are not insurmountable problems. And so what we've done is we've invited a few parents to share their journey. And I know they saw themselves in your slides. I think every parent who is listening today has seen themselves in your slides, but nothing brings to life your data and your information more than a story. So I'd like to start by inviting Danae Hooks to come on her webcam. Danae is our state rep in the state of Texas. She's a parent to beautiful Hannah. And Danae's going to spend a few minutes sharing their family's journey with nutrition and diet and growth with Rett syndrome. And maybe at the end of sharing your story, Danae, you'll ask a question. If this is still your question, maybe after hearing Susie's information, your question has changed, and that's okay as well. But I'm going to go ahead on mute, and if you would introduce yourself, tell us about a little bit about your family and what the journey has been like for you reaching the age of 9. So for the last 9 years, what's been going on?
Yes, I have a million questions after all of that, so I'll have to put it all in an email. But thank you so much, Susie. That was such great information. And like she said, like Paige said, I saw Hannah in so many of those slides. And we've been on a journey these past 9 years. My name is Danae Hooks, and I live in Lubbock, Texas. And my daughter, Hannah, is 9. She was officially diagnosed with Rett syndrome in Houston at 21 months. And at the time of her diagnosis, she still had use of her hands, and she was still self-feeding whole, regular foods. Now, over the course of the next year or so, she started having difficulty with using her hands and chewing and swallowing food. So we then went to see a therapist, and we were already in therapy, but we went and saw a food therapist, and we got a swallow study done. And it was showing that Hannah was actually not really chewing her food. She was pretty much swallowing everything whole. So at that point, we had to shift to doing strictly pureed foods for Hannah. So I came up with all these different combinations for her nutrition, fat, to help, gain weight, maintain weight. And we did that for maybe a year, and she was still having trouble eating. She was gagging a lot. She was losing weight. So there was just a lot of different things that started to happen. So we got another swallow study done, and it did show, the dysphagia and the aspiration with almost every single bite and sip of water that she took. So at that point, we really had to consider, with the weight loss and the safety issues of her eating by mouth, we had to consider getting her G tube placed. And at the time, I really fought it. Looking back, hindsight, it was the best decision that we could ever make. But I really fought it at the time. So we went ahead and did the G tube placement. And, after that, after recovery, it was a pretty easy recovery. It was more, a trial and error basis of figuring out what the timing of her feeds, the amount to give her, the water ratio, the different types of formula. So, we finally figured that out. And there for a little bit, we tried to do whole food blends. And at the time, it wasn't sustainable for our family. We were having a lot of trouble with Hannah doing it, and I was having trouble with it. And so we went to 100% formula fed with Hannah. And at 9 years old, that is what we are currently doing. And, I'm very happy to say that Hannah is at a very healthy weight. We finally hit a little bit above average for her weight. And her latest blood tests show that she's very healthy. Nutrition is good. And I love that we have the feeding tube because, like I said, weight gain, but we're also able to keep her hydrated, which helps with her constipation issues. And we're able to vent because she does have a lot of breath holding and hyperventilation. And then, we're able to, her calorie intake is really good. When she gets sick, we're able to make sure she's hydrated, make sure she has all of her medicines. And again, that helps as well. She does have upcoming scoliosis surgery. So doctor's orders are to maintain at the minimum, but to add a pound, if we can, add a pound a month until her scoliosis surgery. So, right now at this moment, because she is healthy and because everything is kind of evened out and she's doing really, really good nutritionally, I don't want to change anything up. But one of my questions for Susie would be, in the future, if we wanted to revisit the whole food blends, kind of what would a transition look like for her? And would it help with her discomfort with bloating and the gas that she does have? So that's definitely something next level that we want to do with her nutrition. But like I said, right now with scoliosis on the horizon, with spinal fusion on the horizon, we want to maintain where she's at and try to gain a little bit as well.
Renee, I appreciate where you're coming from. And parents often say, I really had to give it a lot of thought before I put that G tube in. But I think one misconception that people have is that it's really major surgery.
Right.
That whole process has evolved now. So a lot of it is often done with scopes and stuff. So it's not the major surgery that we used to think about. I'm glad that you're preparing her for scoliosis surgery. It's helpful that she has a feeding tube, because they will be able to continue feeding her even in those early days post-surgery. The girls that don't have a feeding tube, it can be a little bit difficult because often after surgery, the girls are really sleepy. Mm-hmm. And a lot of them have reported that they've lost their appetite for an extended period of time. So that makes it a challenge. Some of our girls have ended up with temporary NG feedings going home to maintain them through those early days, early weeks. So she has a tube in place. We all know what to use with it. So that's definitely a plus. One thing that we pay attention to prior to scoliosis surgery is we check with their iron status. Usually your pediatrician and your surgeon are going to be looking at her iron status. But we sometimes add a little bit of extra vitamin C and zinc too, which will help to prepare for healing. And they can give you some guidance on that. But what we used to do, we had a protocol. We would use a multivitamin, a complete multivitamin, like 3 days a week. And then we used a multivitamin with extra C 4 days a week. So we sort of balanced it out that way and sort of prepared them to get ready for that surgery. After, and I totally agree with you, she's in a good place. Getting her weight up a little bit probably is not going to hurt, and they can direct you about how much that needs to be. But in the future, you may want to try a whole food blend again. Sometimes the scoliosis itself actually significantly affects the GI tract and how it's working. It affects constipation. It can affect reflux and all of those things. So sometimes we see an improvement in GI function after the surgery is over. So we're always very hopeful for that. Sometimes not, but you're going to be following her closely and kind of know. So at some point you may want to go back if things are better, go back and try a whole foods blend again and see if that agrees with her at that time. But always remember there are good formulas out there. You found one already. There are many now and many things that we can choose from. So there are always options that we can look at. And one thing that I never do is I never transition cold turkey from one thing to another. Is I always go slowly and slowly transition, slowly off of commercial products to something that's more blended. Because to me, it just makes sense that it was a slow transition when we got there, and now it's going to be a slow transition trying to go the other way. And also following her closely to know if we need to make modifications to make sure that she's staying healthy and growing the way that she should.
So regular blood work to make sure everything's, healthy.
Well, regular growth checkups too.
Checkups. Okay.
Height and weight, even afterwards, try to do a height and weight. We do know, and we've been told too, that sometimes it depends on what type of rods you're in. If they're the stable rods, that sometimes their trunk actually won't grow very much, but their legs continue to grow.
Yes.
We had a young girl in the other day that had scoliosis surgery back in 18, and her legs were continuing to grow. So we were even monitoring by changes of pants and how much her legs were growing. And you can actually measure the legs and see how they're growing too. So even though the trunk may not grow anymore, sometimes their legs and stuff grow. So we do see some growth sometimes afterwards. And then sometimes we don't. So it's variable, but you need to make sure that she's maintaining weight. And again, just sort of get a handle on where we're going with height for long-term needs.
Okay.
So in terms of going back to blended foods and whole food blends, sometimes it does help reduce with bloating and discomfort. Sometimes it doesn't. It's a very individual thing, but I do think that it would be worth to, if you can, slowly transition and see if it would make any difference. But as everybody knows, sometimes the bloating and the discomfort is actually part of Rett syndrome too. And it's something that we wish we had control over, but so far we've not been able to get good control over that.
That's probably the biggest thing that she suffers from right now is the bloating and the constipation in the air, the venting and stuff that we have to do a lot of the time. Hannah is all legs, so
There you go. Those legs,
be okay.
they're probably going to continue to grow. In constipation, it's always helpful to try a high fiber diet. I mean, even going back to unprocessed bran that we used to add to foods a long time ago, if they tolerate that, back to bran cereals, that type of stuff. But with good fiber sources and good hydration, as you mentioned, it's great that you're able to get better hydration with her now. But even then, sometimes they still need medication to help them grow. Right. And sometimes those medications can make a tremendous amount of difference in their constipation issues. So don't be hesitant to work with GI to find the program that works for her.
Okay. Thank you so much. I really appreciate it.
You're welcome.
Oops. Thank you so much, Danae. We appreciate hearing from you in Texas. And again, reminding everyone that we've invited some of our state reps on because their contact information is on our website. If you go to Family Resources on rettsyndrome.org, you can find Danae. So if you see yourself in her story and you're coming up behind her in age and you want to talk a little bit more directly about how they as a family got to this good place that they're at now, Danae is happy to hear from you. But we're going to leave Texas now. We're going to hop over to Colorado. And I'd like to introduce Heidi Greenall, who's our state representative volunteer. Thank you, Heidi, for all that you do for the Rett syndrome community. And today, thank you for sharing about your journey with Ellie. And I'm going to go quiet. I know we still need to pack in a lot in the next 20 minutes. So let's hear about your journey a little bit and let you get a question in for Susie.
All right. I'm going to try to be quick because I will tend to ramble on and I don't want to do that because I know I'm on a time crunch. So let me just tell you a little bit about Ellie. She is 13 years old, and as you can see from her picture, she's a little mischievous. She is she's a little different than some Rett girls, I think. She's 5'4", weighs 105 pounds, and wears a size 9 women's shoe. So she has just shot up. She's giant. But what we started with was a 29-week-old preemie. So she was very, very tiny when she was born. She was 3 pounds. So nutrition has always been part of our journey with Ellie. We always had to make sure she was getting enough of everything she needed to grow. She was on special formula when she was a preemie, but she did grow, and she caught up pretty quick. And another interesting thing about Ellie is she was not diagnosed with Rett until she was 7 years old. So we went all that time dealing with all the issues that all of our Rett families are dealing with now with nutrition, not having any clue that it was Rett syndrome. So we had to just kind of figure this all out on our own. I still remember the first time Ellie was constipated. We were on the beach. We were in Cannon Beach in Oregon, and out of nowhere, she started screaming, and I didn't know what was going on. And it turned out that's what it was. And from that point on, it's been a journey for us with constipation and just making sure her diet is right, so everything keeps working. Another thing about Ellie, we found out at around the same time, she has a peanut allergy. So we've had to be very mindful of that as well. We've never had her tested for it, but we do think that she's lactose intolerant. So when we were trying to figure out the constipation stuff when she was little, we tried every kind of diet possible. We were dairy free. She's still pretty much dairy free. She doesn't drink milk, but she does eat yogurt and cheese, and she seems to be okay. But if she has a milkshake, she gets really upset. So I do think there's some milk issues going on there. We did gluten-free. We've supplemented all kinds of things. She was vegan at one point. She's been vegetarian, and we've tried it all. And over the years now, well, actually, once she was diagnosed, everything opened up to us, and we're like, oh, okay, this is what we need to do. This is what happens with Rett girls. So we have really paid attention to her diet. We know the foods that will back her up. We know the foods that she needs to eat to stay flowing. We know she drinks a lot of water. Ellie is mobile, and she is also able to self-feed. Another thing we had a challenge with when she was little was she could self-feed. She has use of her right hand, but she would shove food in her mouth so much that she would gag. So we did end up getting a swallow study, and they said there was like a little something was off, but they thought it was just because of her being premature. And even just listening to this, listening to Suzanne now I wonder if we should have had another, swallow study to see what really was going on in there after she got diagnosed. So, but the older she got, that stopped. So she rarely chokes anymore. She's able to feed herself. Like I said, she can hold a cup. She drinks a ton of water. But sometimes it seems like no matter what we do, we still have this issue with constipation, with trying to make sure she's getting everything she needs. And, we've gone down the whole road of the Miralax, Natural Calm, X-Lax. We've tried just about everything. And now we've gotten to a point, I think, after, 13 years, where we give her Natural Calm when it seems like things are getting a little off. Anytime she eats like a bagel, I give her some Natural Calm. If she gets backed up for more than 2 days, we go through the Miralax, clean out. So I think it's just become part of our lives now. But my next level question is, now that Ellie is in puberty, we have noticed that even though we felt like we had everything under control, she gets very, very, very constipated before she starts. So we're trying now to figure out what we need to do with that. I've upped the natural calm. I'm giving her a lot of fiber. Like I said, she drinks a lot of water. We try not to give her the foods that back her up, but that's become an issue again, where just when we thought we had it under control, then everything changed, like it always does. It seems to be with Rett syndrome. And also my other concern is, now that she is puberty, the weight gain, and how do we manage that? She is very active. She doesn't really stop moving. So I feel like in a way she's constantly exercising. So maybe that will help. But at the same time, you know, she is 5'4", and all her doctors keep saying that they think she'll be like 5'6" or 7. But now that Suzanne said it's kind of when they stop, now I'm thinking, oh, maybe she's going to be 5'4". So anyway, that's our journey. We've, you know, done a ton. We've tried everything, I feel like. And but you know, we're at a pretty good spot right now, I think, with knowing what foods work and don't work for her. And I think that's a big key for sure.
Heidi, that's a great story. I'm glad we're sharing stories. That's a great story. I have heard it before over time. Doesn't happen very often, but with the late diagnosis, it's very interesting, the things that we can learn from those experiences.
Yeah.
In terms of seeing constipation again, it's kind of, when you were talking about that, it made me think of seizures. It's interesting because sometimes when the girls are in their cycles, they have more seizures.
Yeah, Ellie doesn't
like we come up with a special program to use during that period of time so that we can reduce seizures, but it's sort of, we just use it on during that cycle, that part of the cycle is when they use it. So it may be with Ellie that we're going to have to come up, or you're going to have to come up with something that we're using more of something. Maybe just that short period of time that she needs it to sort of get her through that short period of time when constipation is worse. I know a lot of people use natural calm. It's always best to talk to your pediatrician because there are other medications that can be used as well. And sometimes you may just need a little bit to sort of to tide her over until we're through those first few days or whatever it is that's influencing that. Weight gain, most important thing is monitor it. I mean, make sure that you have a way to weigh her. Like every month, put her on the scale and put it on the calendar so that you kind of know what she's doing.
Okay.
And she may or may not get taller. This is a good case of everybody's an individual.
Right.
And you just need to see. Right. I wouldn't hesitate to weigh her once a month. Excuse me. And just kind of make sure that she's sort of staying stable. If she's 105, she's a little bit on the lean side.
She's always been very tall and skinny. That's her thing. She's always been tall and thin. But you look at her now, you can see she's filling in a little bit. It's you can see it, and it's a little weird. Like she comes downstairs sometimes, and you're like, or all of a sudden she's a little more eye level. I'm 5'8", but she's getting closer.
There,
and
so
it's
really
weird.
Something. Your story is going to continue to change. Like I said, it may be that we need to talk to your pediatrician or GI, whoever you work with, to maybe come up with a temporary program that you can use those few days that you need to. It's great that she's a good drinker. And again, I would certainly watch her weight and make sure that it's an appropriate gain as she gets taller. I see your initial question was about vitamin or mineral supplements. If she is healthy, she may not need them.
Okay.
But she is of a good weight. So, I mean, she would be able to use an adult supplement, but watch out for iron. If there's, and of course, when she is having periods, she may or may not need iron. So I would sort of keep your pediatrician. A lot of our girls get referred to as special needs OBGYN. So that we can have those type of discussions with them. But again, she would be a candidate for an adult vitamin and mineral with her current weight and her current size. So that's a good thing. And she may or may not need iron. A lot of the adult vitamins don't have as much iron in them as the children's ones do. So you could just choose a good one that meets her needs.
I know there's like the, teenage girl supplements or teenage supplements. Is that something that we may or may not need it?
You may or may not need them. Some of the teen ones have a good bit of iron in them. So just maybe, do you take vitamins yourself?
When I remember.
Okay, I got it.
Which is kind of the same with Ellie's. Like I'll say I'll forget. And I always give her probiotic though. I'm very good with the
Okay.
probiotic. Yeah.
Good, good. I think we're going to be learning a whole lot more about that now that we're actually have all this new technology available to us and people that are interested in it. So I think we're going to learn a lot more about that, the need for that as well.
Right.
I would compare your multivitamin to a teen multivitamin and see which is probably lower in iron, because we don't
Okay.
want to contribute to the constipation problem. But again, should she have trouble menses, then that needs to be looked at medically, and if she needs iron or not.
Okay.
Okay.
So far, it's pretty easy. I knock on wood. I have to
Yeah.
admit, I was very nervous about this phase of our life, but it's no big deal. No big deal at all.
Yay.
Yeah,
That's good
I
news.
think we're very lucky. So
Yeah. That's wonderful. Good
Yeah.
news. Thanks for sharing with us.
yeah, thank you.
Thank you, Heidi. Thank you, Danae. It's been great to learn about Ellie and Hannah. And now we're going to take off from Colorado and we're going to head over to Wisconsin. And we're going to learn about Kira. And Patty, if you want to turn on your webcam, I think a lot of families know you. You've been a representative for IRSF for a long time, and you're always so generous with sharing your learnings in all areas and all aspects of Rett syndrome. But let's focus in on nutrition today. Can you take us on your journey?
Thanks, Paige. I will try to keep it quick so we can get to some of the questions in the chat or the Q&A. Our experience, Kira is now 15. She was diagnosed a little over 2. She ended up with a feeding tube at age 4 after numerous bouts of aspiration pneumonia. And I have to say our story mirrors the other 2 presenters. So many similarities. But I think I'll just jump right now. We finally got to a place. We started with her feeding tube, and that's been 11 years ago. There wasn't a ton of choices on formulas. We started with what I figured was the best, but she struggled with constipation, with reflux. It just didn't seem like that was a good fit for her. And so we kind of kept challenging, what could we do differently? We tried moving to the real food blends, and that was okay, but we still, in talking to the dietitian, that was still a struggle to have it be complete. We also didn't have a nutritionist that was supporting us in trying to do a home blend. And after about a year of asking, I finally just tried it on my own, which I wasn't super educated at the time. I filled up a little toddler plate with what I thought looked like about the right amount of servings with some healthy foods, and we threw it in a blender. And monitoring her weight, we realized we weren't quite on track. Kira's never struggled with her weight, never struggled being underweight. She's always been a chunky little thing. So she had a little wiggle room there, but that was when we realized we needed to find a different nutritionist and a different GI team that was going to embrace a whole food blend. So we did that. We slowly moved through the real food blends and then started kind of playing with our own. And we have been doing that probably for the last 9 years. It's just become part of how we roll. We have her in for lab work frequently, and that's always driven some of our adjustments. There was a time she had too many prunes in her blend, and I think it was her selenium levels were too high, so we made an adjustment there. We are struggling with that constipation all the time, trying to go about it from a whole foods standpoint and making sure that we're putting the right ingredients in her blends. She does eat the healthiest out of all of us, and I have to say the illnesses have subsided. She's probably the healthiest of our 3 kids as far as not picking up colds and bugs that go around. And I do believe part of it is her nutrition. So our process, she still can eat a little bit by mouth. And I loved hearing Susie say that can be that social time. That's what it is for Kira. And we don't feel bad letting her eat some cheese puffs or we call it junk cereal, something fun to eat, because we're not worried about the nutrition coming from that. And that can just be her joy of chomping on something to be up at the table with us and have that social aspect. We have gone to just having, on the weekends, I make her blends. I make a week's worth or 3 weeks worth, depends on what fits in the freezer. We have little containers that we put them in, and I put everything on a little card, whatever I'm putting in it. And I used to handwrite it all out. I've gotten to the point that I kind of know the variety that I put in there. And I just have it here so I can quick circle it. We tape it on. And when it comes out, we just have a notebook in the cupboard. I tape them in. It also gives me a place that I can track bowel movements. I can track seizures. And when we go in to see the nutritionist or her neurologist, I've got everything there. It also gives us time to say, this one, she really seemed like she was more bloated this week. What were we feeding her? And what seems to be the trigger to that. So that's kind of where we're at. But there's always kind of the superfoods. We keep hearing more, learning more and more, and hearing more and more. So my question, Susie, again, it's the constipation issue. What are, besides prunes, we use olive oil. We were needing some extra calories, so we're using olive oil. Flaxseed goes in her blends, a little bit of blackstrap molasses, and then we vary it with either whole wheat bread, quinoa, oatmeal as kind of the grain. We have fruits, vegetables, and proteins in there. So it's all pretty healthy. But are there any other things? We work to reduce Miralax. She's only on 2 teaspoons a day, and sometimes less than that. So that's not too much, I don't think. But
Good. Patty, thank you for sharing that with everybody. And I'm sorry that you didn't get any support in the beginning. Like I said, I think,
you know what, it gave me strength to know that you don't always have to stay with the team you start with. If it's not a good fit, it's okay to look and find a good fit.
That's right. The foods that you mentioned are the superfoods, the oatmeals and the quinoa and all of those things. Those are considered to be the superfoods. And people have told us a lot about, for some reason, cherry juice seems to be effective sometimes to help with constipation. It seems to help some people and doesn't seem to help other people. Pear juice also seems to help some people and not help other people. So we hear that often. In terms of constipation medication, Miralax is often used. You're right, you have to dose it according to what their needs are. If they get too much, it can cause 2 loose stools, and we don't want that to happen either. So, but Miralax is safe to use. It's not addictive, and there really aren't any side effects. So it's good to use that. But we have found that it doesn't work for everybody. Some of the girls use milk of magnesia instead, and the pediatrician or GI can help you dose that. If your daughter has trouble pushing out stool, sometimes the milk of magnesia actually gives a little bit of push sensation by the mechanism that it has. We have some girls that use Miralax and milk of magnesia to help them go every day. So it's really variable. A lot of girls are on Senna as well. So it's that individualized thing. You have to work with diet, which you have, and y'all have come such a long way doing that and using superfoods. A little bit of medicine may be necessary, but again, work with the pediatrician, work with your GI, figure out if there's another blend, and it may change. It may be that at some point that we need to come up with a new plan altogether. And I think that's what's so exciting about the stuff that's on the horizon, is we're hoping that some of these things are going to give us answers that we didn't have before in terms of probiotics and medications and all that type of stuff. So it's just such a wonderful thing to see that we're moving. That's kind of the first step. They call it a landmark study. It really is a landmark study, and it's so exciting for people in science, but also for our Rett families too.
Thank you, Susie. Patty, thank you for sharing your journey with Kira, and I applaud your dedication to your home garden and your home blends, and for sharing the packaging and the freezing, all of those things that can help the day-to-day process along. And I'm glad to hear that Kira is benefiting so well. The fewest illnesses and colds and flus. Seems like you're doing something right. And I know that you've offered, if people want to find you on our website and email you, that you might be willing to share some recipes that have worked for Kira. And
those packaging tips are great. Her packaging tips are great.
Yeah, and we blend that.
Label is great.
That takes up the least space in the freezer. We can freeze a bunch. We blend them in the evenings, and then sometimes we blend a couple and put them back in the freezer.
Mhm.
There's tips that we figured out over the years to make it more manageable, that we're not creating a new blend every single night.
That's great. And thanks for sharing.
Yeah, and Susie, we picked up on the big, bold variety of variety. So,
Yes, that's right. That's what I want you to remember is
mhm.
variety. That's right.
Okay, well, we're really close to
Mhm.
the finale, our final time together today. But we have had a lot of really good questions. So Susie, I know you took the time to look at the questions that were submitted and tried to prioritize some that you thought maybe weren't touched on as deeply in the presentation or in the case studies that were shared today. Would you mind taking a few minutes to look through
Let me
that?
just read this one. It says, how to increase hydration. My daughter really doesn't seem to drink very much. Only about 8 ounces in a meal and often takes only sips throughout the day. It's always been interesting to me. Many of the girls, I think, have trouble handling the flow of fluids. And it has to do with that whole GI tract is involved. And I think often they think, maybe I'm going to choke. And so sometimes you can start with thickening fluids. You can thicken fluids with natural foods. It doesn't even have to be a thickening agent, or you can use thickening agent. So you may want to try thickening it and see if that helps your child to feel more comfortable. Always remember that a lot of foods, anything that melts to fluid is considered to be a fluid. If she ate a popsicle, if she had juice, if she had ice cream that day, anything that melts is also considered to be a fluid. So sometimes they're getting in more fluids than you think. We have had some people that actually got feeding tubes just for hydration, though, along the line. That often that their feedings are sometimes just water. So again, it's an individualized decision, but hydration is essential. And if there's issues with getting it in, then we need to individualize, seek out the assistance of your pediatrician or some feeding people that you're working with, and try to come up with a plan that's going to fit your child's needs. Another question was, how can we test and know that our child is getting sufficient nutrients from foods fed orally? We are sort of proactive and we advocate healthy diet in the first place, which puts a foundation for better health in the beginning. There are tests that you can do, vitamin and mineral screens, protein levels. There are other tests that you can do if necessary, but often the physicians and sometimes the GI people don't like to do the invasive stuff either. So my suggestion is to definitely start off with a healthy diet, and then also work with your physicians to sort of set up what they think is really necessary to make sure that they're getting in what they need. But it's actually a minimum panel of probably what you need. I know some of our girls that we see in our Rett clinic, we just see them annually. So annually, we decide where we're going. What do we need this time? You know, what do we think by this person's history? Always come with a good history. By this person's history, what do we need to try to look at to make sure that we've got all of our bases covered? So there's not any certain test, but it starts with good nutrition, and then see what take a good history in with your team and your pediatrician and decide if they think anything needs to be done. Here's another question about my daughter. Does not seem to be able to tolerate milk for many years. She was on almond milk. They had allergy testing done. It didn't say that she was allergic to milk. So mom said they decided about 4 months ago that they were going to start her on a lactose-free product. And then now she's vomiting about once a week. So she doesn't know if it's the new milk product or not. So how can we tell if it's the milk causing the problem? That's a good question. Sometimes we don't always have a clear answer about that. There are other milk products on the market now. if we take that milk away and we add it back and we're seeing the vomiting, then maybe there is some type of sensitivity there. There are other milk products on the market now, but again, try to always get something that has a protein, calcium, vitamin D blend, because that's the advantage to dairy foods in the first place. And there are a lot of vegan non-dairy products out there now that are actually really good. So, okay.
Susie, I know that the word milk is thrown around a lot. So families are asking, there's a few in the chat, if almond milk, is it the word milk that we're tuning into, or is it looking at that vitamin C, vitamin D, or the vitamin D and calcium, and that's what's most important for our girls?
It's really looking at that blend of high quality protein, calcium, and vitamin D, trying to find something that meets that need. So it doesn't necessarily have to be cow's milk, but try to find that blend, and those products are out there now too. The other thing that in the questions that really came up is there were some significant GI issues that were asked questions about. One young lady has pancreatitis and now she's having trouble with glucose regulation. Another young lady recently had her gallbladder out, so she's now just sort of in recovery from that and starting to slowly advance her diet. And another one had GI gastroparesis. So again, it just sort of points out the diversity of problems that we can see with Rett syndrome, with the GI tract. Those are all highly specialized areas of GI medicine. And I know those people are getting their needs met by their GI medicine people. So, but it does, again, I think it points out the need that GI stuff happens frequently. We have to individualize the therapy. And with these particular cases, that needs to be highly individualized with qualified individuals. So.
Okay. So as we reach the conclusion, I know there are some additional questions in the queue, and what we'll do is we'll export those questions, share them with Susie. I don't have a timestamp on when they were asked, so they may very well have been covered in the presentation. If we do have any questions that weren't covered in the presentation, if it's unique to an individual, we'll get back to you. If it's more generalized response that would help a lot of people in our community, we'll get some QA documents posted to go with the YouTube recording. But I don't think that there's a topic that we didn't touch on today. Quite a robust session. Thank you so much, Susie, for all of your experience, your dedication, your empathy, your compassion, and really for your connectedness and care for all of the individuals with Rett syndrome, our girls, our boys, our adults, our teens. You have seen quite a few of them grow from littles to adults, and I really trust your advice.
I love that. That's just the highlight of my career, has been able to do this and to meet all you wonderful people. So best wishes.
All right. Well, thank you very much. I think that our takeaway here is for parents, don't be afraid to try new things, work through the issues that you have, trust your gut.
Absolutely.
Trust your gut that it could be food sensitivities that you're having, and then there might be some cycles of things, whether it's the onset of menstruation, maybe it's seizures, maybe it's some oral, motor, muscular complexities that enter the picture. All of those things are common, and you have an entire community here, whether it's on our Facebook groups or going to our centers of excellence, or just really partnering with a nutritionist, dietitian, pediatrician in your community. You can get answers. You can get blood tests to support the things you're trying to make sure that they continue on a good path of health. But there's a lot of options out there. And sometimes that can feel overwhelming, and you're not alone. That's the takeaway. So thank you very much. Danae, Patty, Heidi, thank you for sharing your family's journey and for continuing to be such great volunteers for our community. We appreciate you. We hope to see everybody in Nashville in a few months. Enjoy the holidays, and we'll see you next month. We have an OT hand splint specialist presentation coming up for our RettEd in December. So we'll see you again in a month from now. Until then, be well, everybody. Have a good, healthy diet. Have a good, healthy dinner or breakfast or lunch, depending on where you are on the globe. and take care. Let us know if you have any further questions, and we would look forward to bringing you more RettEds on a regular basis. All right, Susie, don't work too hard. Thank you so much for your time today.
Thank you. Bye, everybody.
Take care, everyone. Bye-bye.